The biggest mistake in aesthetic training. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. The biggest mistake in aesthetic training, and why complications keep happening. One of the biggest misconceptions in aesthetics is that injecting is mainly about learning points, measurements, and formulas. It is not. Many injectors are taught to memorize patterns. Inject here, inject this depth, inject this number of units. But human anatomy is not fixed. Every patient is different. Muscle strength differs, fat compartments differ, ligaments differ, vascular anatomy differs, aging differs. This means the same injection pattern can produce completely different outcomes in different patients. One reason complications happen is because some injectors are trained to follow recipes, rather than assess anatomy. Assessment should come before treatment, not after. An injector should first analyze movement, volume loss, facial proportions, aging patterns, and tissue support. Good injectors do not simply treat lines. They assess the entire face. Social media has worsened this problem. Short videos often oversimplify anatomy and create the illusion that aesthetics is easy. But aesthetics is still medicine, and complications can be serious, including vascular occlusion, blindness, tissue injury, and functional complications. This is why anatomy matters so much. Not just memorizing anatomy diagrams, but understanding anatomy in 3 dimensions. Cadaver training changes the way injectors think. Because anatomy becomes real, depth becomes real, planes become real, and danger zones become real. Many injectors are surprised during cadaver training, because structures are often not where they expected them to be. Another major issue is misunderstanding cannulas and needles. Neither is automatically safe. Safety depends on anatomy, technique, depth, and clinical judgment. Experienced injectors constantly reassess during treatment. They do not simply complete a pre-planned map. Good aesthetic medicine is dynamic, not robotic. One of the most dangerous mindsets in aesthetics is believing confidence equals competence. True competence requires ongoing learning. The best injectors usually become more conservative over time, not more aggressive, because experience teaches respect for anatomy. Ultimately, the goal is not simply to inject product. The goal is to understand the face, understand aging, and treat patients safely. Aesthetics and Skin Institute. Evidence-based education in injectables, lasers, anatomy, and aesthetic medicine. Aesthetics and Skin Institute.